What does the process of care entail for these patients?
Once we transport them to the school, either through private cars or taxis with volunteers, they come and sit into the clinic. We go over a full medical history with them. We take their blood pressure to make sure everything's okay for the day. We also get hemoglobin levels or red blood cell levels faxed over if any of the patients are diabetic or have any other conditions that we want to make sure everything's safe for the day. Once we sit them in the chair, we do full extraoral exams, which means we're touching the head and the neck, just to make sure we don't find any lumps or bumps that they may need to go see a doctor for. Once we do the extraoral exam, we go to the intraoral exam and we check around the tongue and the throat because oral cancer is having a huge impact around the world, and it's very important to be screening for this. Once we do the intraoral exam, we then go into x-rays. Dental x-rays are really important because they help us to find any infections or abscesses around the jawbone, any cysts or tumors. It also helps us to distinguish what type of gum disease they have, which levels, type 1, 2, 3, or 4, and how to really specifically adapt this treatment to them. Once the x-rays are done, we meet with a dentist and he goes over the treatment that needs to be done for the day. Normally we inject them with Novocaine, so it's a less painful process, and we begin the cleanings. Because these patients haven't had dental care pretty much their whole life, we usually break it up into 2 or 3 appointments, short appointments so they don't become intimidated and they don't relay any fear or anxiety with the dentist. Once we start off with a little bit of scaling, we end the visit with a fluoride treatment, which is a vitamin for the teeth, just to make sure that they can be having this consistent vitamin throughout the months if they can't go see a dentist for a while. After this is all done, we figure out their language and we set them up with a dental clinic around Boston. I don't know if many of you know, there are various clinics that have translators available for them. So there's specific Spanish clinics, French, German, whatever language they speak. We set them up with a clinic and they can have various procedures done like restorative work such as fillings, implants, crown works, all that, and we send them with volunteers so they also don't kind of associate that fear with it. And the most important thing that I do is once they have these appointments, I make sure I follow up with them to make sure their care is completed and to make sure that their dental work is completed so we're not leaving any open decay or anything in the mouth that can really affect their overall health. So that's pretty much the process of care that we go through.